Hey guys, we've got Dr. Grant Ross here today. You may remember him from the Doctor's Take on Aesthetic podcast. He's one of our cosmetic physicians here at Contour Clinics. And Grant wants to make himself beautiful today. He wants to do the Morpheus8. Now in the Morpheus8, this device over here, I might walk around. Now the Morpheus8 is a radiofrequency skin needling device. This here is the pins, so I don't know if you can see that very well, but see how there's multiple little pins in there. There's 25 of them. Now they pierce through the skin all at the same time and they fire a radio frequency current that goes between them, and that causes a really intense collagen stimulating process. Now Grant's had, you can see here, we've done a local anesthetic block. There's a supraorbital and supratrochlear nerves that come out around here. We've got the infraorbital nerve that comes out here, and then we've got the mental nerves that come out here. And they supply most of the face. We've got a little one here called the zygomaticotemporal nerve. We've infiltrated some anesthetic all around those nerves, and that's going to give you a really comfortable treatment because this can have a little bit of a bite to it, the Morpheus. So the benefits of this treatment are an intensive collagen stimulation. What this will do is this will cause a tightening of the skin. If you're full through these areas here, sometimes it can melt a tiny little bit of fat, but probably not too much. There's really nothing, in my opinion, that's better in terms of collagen stimulation. I think it's really one of the best things you can do. So think about normal skin needling. This is like skin needling on steroids. So if you see now, the needles, you can watch the needles kind of go in. So what you want to do is you want to do a collagen stimulating treatment every year. Now, our skin doesn't have an ability to heal naturally. So if you were to just let your skin just age gracefully, it would just slowly age over time. Now we need some kind of stimulus to cause the skin to heal. So we like to cause a controlled micro damage. So lasers like this one here, skin needling like this device here, they all cause a controlled micro damage, and then your skin's ability to heal that micro damage is what gives you the results. So what we're attempting to achieve here is that Grant's got ever so slight laxity of the skin, particularly around the jawline. We're trying to lift that up. That was slightly worse before we did the Morpheus a couple of months ago. This will be his second session now. We want to aim for 3 sessions. It's spaced a month to 6 weeks apart at a minimum, but I mean, there's no real maximum time you can wait between them. This treatment does have a bit of a bite to it, so we like to use a numbing cream that stays on for about half an hour before. So that gives a real comfortable treatment. You can see Grant here is he's almost asleep. Downtime is different for everyone. So some people are more sensitive than others. Some people can swell a little bit, so maybe that's a couple of days. So anywhere from say 2 to 5 days of swelling. I've seen someone with no swelling on day 1 afterwards. One of our nurses here had it done, and the next day she come to treat her patients. I couldn't even tell that she had anything done. Other people though might be a bit red and swollen for up to a week afterwards. You see Grant has a lighter skin type. So we judge skin types based on something called a Fitzpatrick scale. 1 being no pigment in the skin, so albino people have the 1 pigment, the Fitzpatrick one, and then all the way up to a 6, which is a Northern African kind of skin type. This is better for the lighter skin types. Now for darker skin types, we can still do it, but we like to use a pigment inhibitor. When we deliver trauma to the skin, there is a risk of something called post-inflammatory hyperpigmentation. So that is a pigment that follows trauma. We are going to cause a trauma here, but in a very controlled way. But there is still a risk of causing a pigment that follows this trauma. So what we like to do is switch off your pigment producing cells beforehand. So this is the cream we were talking about, the brightening cream from Illume. So this has an ingredient in there called 4NB. It is the most effective pigment inhibitor in any skincare range at the moment, based on clinical studies. Sometimes if you've got really kind of lax skin under the eyes, I would say this is probably a better treatment for that. So the CO2 Alma hybrid laser, because that can resurface the skin and really cause an external superficial skin tightening. This treatment is also good for that, but I think it's even better for, you know, that puffiness under the eyes, people that have a real fullness and a bagging under the eyes. That's really what this is really good for, this treatment. The other thing that this is doing, you can see Catalina's doing it around the eyes here, and that can actually cause a lifting of the outer brow. So as we get older, everything gets heavier. You can see some of the skin here. It's formed a little fold around the top part of the eyelid. Doing some tightening around the top part here is going to smooth that out.
Last time after I did it, people said that I look 5 years younger, and that was the eyes, I think.
It's good for fine lines, wrinkles. It's good for just general skin luminosity, general skin elasticity. I would say there's no age limit, but any treatment that involves a collagen stimulation, when you're younger, your ability to stimulate collagen is far better than when you're older. So if you're in your 80s, this will make a difference, but not so great compared to when you're in your 30s. I mean, there's that old saying, ounce of prevention is better than a pound of cure. You really want to get to this early. I mean, we look at Hollywood celebrities that are in their 70s and they look like they're in their 30s. It's because they've done stuff like this since they were 30. They just didn't let their skin age. We're trying to do two things for Grant here. We're trying to prevent aging, and we're also trying to reverse some of the aging that's already happening. So a lot of people, they look at some of these cosmetic treatments and they think to themselves, oh, well, you know, the before and after is not that great. And I think part of the thing they've got to think of is that there is the before and after that we're trying to get. We're trying to improve the look of the skin, but we're also trying to cause an anti-aging. We're trying to stop aging from happening. The neck here, you've got a long flat sheet of muscle. It's called the platysma. Now it's going to attach to these collarbones here, and it's going to come all the way up the neck and what we call interdigitate with some of the muscles of the face. So it's going to mesh in with some of the small muscles at the lower part of the face. And its action is to cause those bands. It'll pull down on the jawline. So if we relax that muscle with an anti-wrinkle injection, we can cause a subtle lifting of the jawline. Why it's relevant for a treatment like this is that that muscle is very, very close to the skin. So when we do skin needling here, sometimes it can cause a contraction of the muscle. It can be quite uncomfortable. Part of the reason I haven't had Morpheus, I've had a little bit of sun in the summer months, and when you have a lot of sun, what can happen is that, like I mentioned before, with the post-inflammatory hyperpigmentation, I can get a bit of pigment that'll follow a treatment like this because I've had a bit of sun. So it's good to stay out of the sun for at least 2 to 4 weeks before the treatment. So we mentioned the nerves that I blocked before with the needle. You can also see little parts of his face that have, they're a little bit white there. That's because there's some adrenaline in the anesthetic, and that's causing a blanching of the skin, a whiteness of the skin. That's good in two ways. It tells us where we've actually done the anesthetic, so it helps to identify where the block is. The other thing is that it'll reduce any bruising that he might have and swelling, because all the tiny little veins in his face are kind of clamped down at the moment, so there'll be less swelling in the initial period.
So basically what we do normally is apply a calming balm just to minimize all that redness and releasing all that heat, and of course he's going to feel more comfortable. After 5 days he can use his normal home care. Normally is deep cleanser, and keep using your dehydrated serums like hyaluronic acid. What else do you use normally?
Me, I'm a boy, so I don't use anything on a regular basis except for sun cream in the mornings.
Yeah, okay.
Yeah. An SPF like 50 plus. Bar of soap. Bar of soap, organic of course, with minimal chemicals because I'm an integrative thing. Chuck that in.
Very good.
I take a lot of probiotics, and my diet's generally vegetable based, so it all helps, right?
It is important to start to look after using those pigment inhibitors that the doctor mentioned before. They're actually going to help just to prevent any pigmentation in the future. Using some retinols as well, they're going to help to your skin.
When would you start the retinols?
Normally we recommend after 7 days, like a week after.
Yep.
Yeah. So then, the skin is not going to be too sensitive for that kind of anti-treatment.
What other creams could you use at home?
Normally I recommend to use a moisturizer and sunscreen. That is very important, to prevent any pigmentation.
We've made probably 1,000 little holes across the skin, and it might be hard to actually see them individually, but they're all little open pores. Now, on your skin, naturally, you have lots of bacteria that just sit there, and there can be something called an opportunistic infection that can happen. So what we've done beforehand is cleanse the skin, so with a antiseptic solution, which is going to reduce the burden of bacteria that's on the skin, but there'll still be a couple there. Grant's fit and healthy, so his immune system's going to take care of the rest of them. And then we're doing things like the calming balm, some antiseptic solution to reduce the risk of infection from here, because all these tiny little channels are all pores for infection to get in. So we don't want to ruin any result by causing an infection, because infections cause a lot of inflammation, which can reduce your speed of recovery. So that's part of the other reason why we want to be really careful in the short term. So we'll follow Grant's recovery over the next few days and get a feel for what the journey is after this. Within a couple of days, his skin will be back to normal.
Day 2. So here we go, this is day 3. I had the procedure on Tuesday afternoon and it's now Friday. A little bit red, but I did go in the sun. Feeling good. Alrighty, here we are, day 6. looking shiny. Tiny bruise there, but getting tons better, and the outbreak is gone. Looking good. So here I am, day 8 following Morpheus8 treatment. Feeling good, 0 pain. Yeah, and I'm a little bit shiny because I'm wearing sun cream because I'm smart. So here I am, week number 2 exactly. And I'm hanging out here at Tullamarine Airport. Here we go, 2 weeks and 1 day, looking shiny.